president of the National Association of Resident Doctors, Dr. Okhuaihesuyi. I think I got that right.
Good evening. I'm Dr.
I'm sure you're all aware.
I'm Dr.
Welcome to our
Uyilawa. Nice to be here.
Thank you. So we're going to be talking about trending issues in the health sector, but the one that's particularly on the front burner now, which is the strike called by your association. So I'll start with that straight. April 1, today, midnight today, you declared a nationwide strike. Federal government is saying this strike took place despite ongoing negotiations. Why did NARD go ahead to declare a strike despite the ongoing negotiations?
Thank you. Let me start by saying, when a man is hungry,
Doctor,
for like 4 months.
Can you hear us?
I can hear you.
Okay.
Loud and
like
clear.
You went away for a few seconds there. We didn't. All right.
Yeah, a call came in.
Oh, okay.
Yeah. You can imagine what people go through when you have not been paid for 4 months, and you cannot feed your family, feed your children, feed your loved ones, and you expect them to still go to the hospital and work. In most of these politicians, they have had their salaries paid instantly with other DTAs, while you make the interns to suffer. I think it's a big aberration and shameful and painful to allow such things happen to them. And an association, I would expect that we need the welfare of our members to be paramount. And that is why presently we are on strike. There are other reasons why we are on strike, which I may have to go further. I'll give you an example. We lost over 17 members to COVID-19, and the death and service insurance have been promised to them for over 1 year. As it stands, none of them have had any death and service insurance paid to their loved ones and to their family. And you can imagine the caregiver is that. You can also imagine when and you are expected to be paid 5,000 naira as that allowance. Those are the challenges we have been asking government for the past 3 months to help us sort out. And this is why we find ourselves in such a place now.
Okay. So are the negotiations still on, or have they been called off now because of the strike?
We had 3 meetings yesterday. We had one with the Senate Committee on Health, Dr. Yahya Ibrahim, who called all stakeholders to come and find a way out of it. As it stands, we still have House officers not being paid salaries. We have resident doctors that work under the average of gift mix have not been paid all for 4 months. Also, that aside, we only hear promises concerning that the insurance will be paid to them, but as it stands, no insurance paid to anybody, and we are still struggling to get them paid. That is 5,000 naira when the House of Senate and House of Rep have been paid 1.2 million naira for hardship allowance. So you can compare which one where we have our things that were discussed, and we had to sign based on promises that we have had for over 10 years now, and they are still promising, telling us to sign an MOU.
Yes, the Ministry of Labour issued a statement today saying that an MOA, Memorandum of Action, had been signed And what that translates to is that there's not going to be strike again today. So he's saying now that the press statement that was issued by the Ministry of Labor today is incorrect.
For a strike action to call off, is called off by the NEC members, not the president and other NOC members there. You are making with the memorandum of understanding signed is what have been also signed over 10 years ago. We signed one last year, we signed one last 2 years, and we're still signing with no implementation. You cannot keep on doing memorandum on actions or memorandum of understanding.
Your volume, you've muted your microphone.
But you can't want to influence them to not affect what you need to affect. So that's what we are calling on government. We have a next meeting in the next 30 minutes to try and to go through what have been offered. And with that, the NEC will determine whether we go on or we call it off.
Okay. Are the doctors working in isolation centers, are they also part of this strike, or they've been exempted from the strike?
The total and indefinite strike, sir. Although we know
total
that
and indefinite.
So for resident doctors, why the medical and dental and consultants are all at the place of work.
Okay, so it will seem as if some Nigerians are being punished unjustly now, if even those who are the isolation center are included.
Well, you can't say that as like you now. Well, you have received your salary, obviously. That's why you're this fresh. Yeah. So you can imagine when people have not received salaries for 4 months. I'm not talking about 1 month, 2 months, 3 months, 4 good months. They have families to eat. They go to the same they'll drive to work. They'll give their children, their fathers, parents money and everything. So how do you expect them to survive? You have turned doctors into beggars, where they go on carrying black hats to tell the nation that they have been owed salaries. That is the situation we find ourselves now. So I think we need to take a really think that it's not just for them. We are also human beings, and we need to also get the best of everything to be able to survive.
I recall that last year, the Minister of Health said about 4 billion had been released for the payment of hazard allowance and all that. So are you saying that money didn't get to?
No. It's wrong. The Minister of Health
the connection is quite poor.
We're able to get
you said the Minister of Health. Okay.
Maji Amela, the Speaker of the House of Rep, was the one that was able to negotiate with the president to be able to release 4 billion naira. 4 billion naira was meant for the medical resident training fund, not hazard allowance. For you to have residents, they go through exams, which we pay for. They travel to places like we do exams in Ibadan and Ghana, which the residents pay for. It's part of what the training is to become a consultant. So if you are made to pay such money, resident training fund, it's part of what we ask for in our. When the fund was paid, over 1,700 people were not paid. And those same people still go for exams, still get accommodations, still go for updates. So we have transferred that burden to the residents. As it stands, over 1,700 people were not paid. About 558 people were paid in error. We have written to government since over 4 months ago, telling them that those paid in error money should be retrieved from them. Only to be told that they have written papers that they do not follow up. That's the case of Nigeria as it stands. We keep on writing papers, writing MOUs, and end up not doing anything after we are about to strike. Now, if we say we are looking and ostrich and leave us in debt, leave us in tears, and leave us in pain without attending to any of our needs. So that's basically the situation we find ourselves.
Why do you think, as you said, why do you think the government is not taking this issue of health seriously? The challenges in the health sector, why do you think they're not being taken seriously?
It will be taken seriously because they have the money to fly abroad. Let me be blunt. Our number one person just to flew abroad to do medical checkup, going in search of best global practices. If if you check the amount of money that we put into tourism, medical tourism, and put such money down in our hospitals here, you don't need to travel. In most of the hospitals that we have now, you barely can have good medical care because the basic necessities are more like luxuries and they are not available in the hospitals. So why won't they travel out? So that's the questions we must ask the government. If an embargo is placed on them seeking healthcare outside, they will help in making the hospital service work inside. So till when that is done, we are going to achieve nothing. That is why during the COVID-19 pandemic last year, most of them that did not travel were able to like go back into the health sector. So I wish there can be laws making government officials to stay in Nigeria and seek healthcare here. We won't have improvement.
Okay, so the Ministry of Labor said you were in a meeting, in a marathon meeting. That's how it was described.
We had a meeting from 4 p.m. to about 12 a.m. this morning.
Yeah, yeah. So, what exactly is causing the impasse now? What is the issue exactly?
There are criteria for calling up a strike. First, we have to call a NEC meeting, which is about to start in the next 20 minutes. When you call a NEC meeting, you now inform the NEC members on the decision and the MOU that have been signed. It's the NEC members that now decide whether to call off the strike or to continue the strike. That's the point we are in now.
Last June there was a strike. Last September there was a strike. Now this is like the third strike within a space of 9 months. It may seem that strike is not really working. What other methods you have you think can work apart from this strike?
The strike we have done is for these same reasons of what we are still going on strike for now. Means there have been so many memorandums of understanding with governments not staying or honoring their own memorandum of understanding. That is why it's difficult for me to stick my head out.
You muted your mic again. You muted your microphone. Maybe you can check that out. Are you there, Dr. Uyi? Are you there?
Yeah, sorry, I had a call came in. So that's why.
Are you there? Can you hear me, doctor? Seems your volume is very low. Your volume has been turned down. Yeah. We've been talking with the president of the National Association of Resident Doctors, and it seems that connection is very good. Can you hear us, Dr. Uyi?
I'm hearing you loud and clear.
It's very low. It's like the microphone is very low. The volume is very low. The volume is low. It's very low.
Loud and clear.
Yeah. It's still very bad. Probably after your NEC meeting, we'll try and reconnect with you again, and then we can have a better interview. We really regret to inform you that the reception has been very, very bad. Network hasn't been good at all. We've been talking with Dr. Uyilawa, the national president of the National Association of Resident Doctors, NARD, which is the umbrella body of all resident doctors and comprises over 16,000 public sector doctors, declared a strike this morning. And they're still having negotiations with the federal government, the issue. Hopefully, Dr. Williams again soon, and the internet connection is much better. Thank you very much.